Bismillahirrahmanirrahim. Today we will discuss ABGs. So, what are the causes of metabolic acidosis? Number one, DKA, diarrhea, renal failure, shock, aspirin dose, and sepsis. Metabolic alkalosis, diuretic with potassium sparing wasting, loss of gastric secretion like vomiting, overuse of NSAIDs. Respiratory acidosis, COPD, hypoventilation, airway obstruction, drug overdose, pulmonary edema, neuromuscular disease. Respiratory alkalosis, hyperventilation, hypoxia, anxiety, pregnancy, high altitude, and fever. So, what are the causes of anionic gap metabolic acidosis? These are the high anion gap metabolic acidosis. So, there is a mnemonic called mud pipe piles. So, M for methanol, U uremia, D for decay, P for paraaldehyde, I for iron and isoniazid, L for lactic acidosis, E ethylene glycol, and S for salicylates. So now in this chart, we will discuss about the type of metabolic acidosis, metabolic alkalosis, respiratory acidosis, alkalosis, and their causes. So first of all, we should know about the normal ranges. The pH normal range is 7.35 to 7.45. Bicarb is 22 to 26, and partial pressure of carbon dioxide is 35 to 45. So what happened in acidosis? So pH should be less than 7.35 and bicarbonate should be less than 22. So the carbon dioxide partial pressure can be compensated or uncompensated. If uncompensated, the partial pressure of carbon dioxide will be in the normal range. But when it is compensated, so there will be a respiratory alkalosis. So in respiratory alkalosis, the partial pressure of carbon dioxide should be lower side, so it is known as respiratory alkalosis. So similarly, in alkalosis metabolic, the pH is more than 7.45 along with a bicarbonate of more than 26. And similarly, the partial pressure of carbon dioxide is normal in uncompensation, but when it is compensated, so it should be higher side. Similarly, respiratory acidosis, the pH should be less than 7.35 along with the partial pressure of carbon dioxide should be more than 45. So it is respiratory acidosis. So the bicarbonate should be either in their normal range, which is uncompensated, but when in compensated, it should be higher side. On the other hand, respiratory alkalosis, the pH should be more than 7.45 and partial pressure of carbon dioxide should be less than 35, and bicarbonate is normal in uncompensated, but when it is compensated, it should be in the lower side. So now we will discuss one scenario. A type 1 diabetic patient using insulin forget to take his insulin with him while visiting his grandparent in the village. After 3 days, he was brought to the city hospital in a drowsy state. He was having a rapid breathing and a recurrent episode of vomiting. A sample of arterial blood was sent for analysis. Most likely finding expected in arterial blood report is. Now take 2 minutes and answer this question. 2 seconds. So this is a case of diabetic ketoacidosis. So the answer should be decreased pH along with lower partial pressure of carbon dioxide and bicarbonate. So a 35-year-old lady having a ABG pH of 7.51, arterial partial pressure of carbon dioxide is 30, plasma bicarbonate is 21, is likely to be suffering from. Take 2 minutes and answer this question. So the answer is respiratory alkalosis. A student was nervous for a big exam and he was rapidly breathing. He would be having what? Take a minute and answer this question. So the answer is respiratory alkalosis. Thank you. Do like and subscribe the channel for the more informational videos.